Welcome to EPG Pathsala. Myself Chandrasekhar Barua, working as Assistant Professor in Indian Institute of Tourism and Travel Management, Gwalior, Madhya Pradesh. Today we are going with a new topic, First Aid, Importance and General Procedure. Contents: Introduction, Background, Major aims of First Aid, What is First Aid, Terms related to First Aid, First Aid Box or Kit, Health Precautions for Tourists, Travelers, Medical Kit, Primary Survey, Training for First Aid, Type of First Aid and Tourism, Symbol of First Aid, Vaccination, Precautions in tour or travel, Keywords, Questions, References, Recommended books. First aid. What are the sources? With all these contents, we are going to start a very detailed information. The first aid required in travel and tourism industry, and what is the role of a tour guide handling the emergencies and how to use these first aid kit. Introduction. Many deaths can be prevented by using a proper first aid before the emergency service arrive at the scene of an injury. First aid is the aid in the assistance given to any tourist or any individual injured or fall sick suddenly with the intention to preserve life or promote his health. It is a kind of first or initial intervention before the arrival of trained doctor or ambulance. First aid is done by the layman. Mental health first is the extension of the concept of first aid. There are situations where we may need first aid. Many countries have legislation, regulation, law or guidance with species minimum level of first aid. This may also include specific training or equipments for first aid. It does not require any equipment specifically. It can be performed on all mammals. Mammals are any vertebrates. Background: in 111th century, Order of St. John was established to train people to medically care in Europe. It was created for war victims. These people were laymen. In 1863, modern Red Cross was created by 4 nations, that is Geneva, one of the country, assist 30th of July 2017. Its primary purpose was to provide aid to sick persons or war injured. But during Industrial Revolution in United Kingdom, a number of people, emergency aid for miners, railway workers. In 1877, St. John Ambulance was formed in England. First aid, which is very important for every traveler. Ancient Egyptians were the first known people to use first aid. There are references about the use of bandage by Greeks also during the war. And there are many references of using the first aid treatment by Roman army. In 1773, Mr. William Havers publicized using artificial respiration for resuscitation. A society of recovery of a person apparently drowned by formed in 1774. Baron Dominic Jean Larrey, Napoleon's surgeon, created ambulance corps. Medical assistance was included, and in this ambulance corps it was like first aid for war victims. Frederick von Bismarck introduced formalized concept of first aid for the military in the year 1870s. First aid assist on 29th of July 2017. Major aims of first aid. Major aims of first aid treatment are given below. Preserve the life, prevent further harm to the injured, promote recovery. What is first aid? Few self limiting injuries, illness, sickness may need first aid only. It consists of simple and life-saving techniques for which most of the people can be trained to execute with minimum required instruments or equipments. It refers to administration of human care can be done on animals also. It is not considered as a medical treatment. It cannot be compared with the treatment done by a qualified doctor. It is a combination of simple procedure and use of common sentence by any individual. Some of the medicines which are commonly kept in the first aid. First aid or emergency. First aid is the service given to the injured or ill person in case of emergency by medically trained person. Medical kit which is used for primary treatment. Every tour guide must know the meaning of first aid. It is very useful in case of emergency. First aid must have following medicines, that is antiseptic liquid. For example, chloroxylenol, also known as parachloromethyl Dettol, Savlon, etc. It contains cetrimide and chlorhexidine gluconate. Dettol and Savlon are brand names of Reckitt and Benixer and ITC. Bandage, cleaning, liquid, cotton, Caesar, tablets for stomach, that is spasmodic purpose, tablets for fever tablet, for vomiting, tablets for loose motions. Terms related to first aid, ABC, that is for air, breathing and circulation. 3 B's, that is breathing, bones, bleeding. 4 B's, breathing, bones, bleeding, burns. A, B, C, D, airway, breathing, circulation and sometimes defibrillation or deadly bleeding. D, R, S, A, B, C, D, that is stand danger response, send for help, airway, breathing, CPR, defibrillation. These are some of the keywords which a trained guide should know. A, B, C and 3 B's are taught to perform in sequentially. This may also include artificial respiration. Airway, first aider has to ensure that airway is clear. Choking may be fatal in the airway. Breathing after airway. Clearance, first aider determines the victim's adequacy of breathing. Circulation, if the casualty is not breathing properly, first aider must give chest compression and rescue breathing. Chest compression may initiate or regulates circulation. First aid box or kit. First aid box, the kit is a collection of items or things used to give treatment to the victims. There is no standard list of items. It varies place to place or country to country depending on the situation, but a tourist transporter or travel agent must keep internally accepted products or products with ISO graphical symbols for first aid in the first aid box, that is first aid kit. It can be assembled in any kind of container. Container should be cleaned as per ISO standard. It should be green with white color cross sign on it. There must be a first aid box kit. Every coach can be trained aircraft. List of contents is given below. Personal protection, equipments, items, and that also covers the gloves, goggles, surgical masks, apron, ABC, nasopharyngeal airway bag, valve, mask, manual aspirator, suction kit, blood pressure cuff, stethoscope, pocket mask, face shield, oropharyngeal airway, other belongings, Lodin bandage, hydrogen peroxide, antiseptic wipes, alcohol and non-alcoholic, saline, dressing, band-aid, cotton balls and swabs, gauze for trauma-related problems, adhesive bandage, dressing, saline soap, antiseptic, homeostatic, etc. Health precautions for the tourist. It is the responsibility of a travel agent or maybe tour operator, tour guide, tour escort or maybe tour manager to take care of the tourist, to advises them properly about medical related problems. Many happens during the travel to see their vaccination record, to ensure them about the availability of good medication, facilities at the destination. Suppose a tour group is going to visit Agra for 3 days. Travel agent must ensure that all tourists are protected from any infectious diseases. A tourist may check availability of appropriate medical services at the destination. Before leaving, he must check the availability of suitable medical services in the place of travel. Self-treatment kits, prophylaxis, emergency treatment packs. For example, a traveler's has a diarrhea kit. Any associated public health risk, for example, the risk of infecting others. Prepare a checklist of vaccine to be taken before traveling to the place. Enquire availability of trained tour guide or other staffs have knowledge of basic medical treatment. Negligence may cause serious problems for the tourist coming from far away places as well as locals due to chances of communicable diseases. Services in the place of travel, self-treatment kits, prophylaxis, emergency treatment packs, for example, a traveler diarrhea kit. Any associated public health risk, for example, the risk of infecting others. Prepare a checklist of vaccine to be taken before traveling to the place. Inquire availability of trained tour guide or other staff have knowledge of basic medical treatment. Negligence may cause serious problems for tourists coming from far away places as well as locals due to chances of communicable diseases. When there is a crowd at the tourism destinations, it is the duty of everyone, stakeholders, local authority, people to be careful and protect all from any diseases. Keep the place clean. Have an eye of local hotels, accommodation, food, outlets, restaurants, team, coffee stalls, nearby places used by the tourists and locals for infection-free environment. By using the first aid, we can initiate medical actions on the victims, but a vigilant society can minimize or protect the whole area from any unwanted situation due to medical problems. Otherwise, there are chances of big break in the tourist traffic, for example, in cause of swine flu, SARS, etc. Travelers medical kit, a travel medical kit box may contains following items. Being a tour guide, you may use this checklist for traveling medical kit. Items in the list depending on the activities of kind of travel. For example, adventure, nature, city tour, mountaineering, cruise, boating, scuba diving, whitewater rafting, kayaking, etc. It also depends on the remoteness of that place. For example, if you are going to high mountains on trekking, you must keep a good traveling medical kit. First, think about that place and what kind of items, that is medical, are available or not available there. There must be meticulous planning before going on tour. Think about the worst situation and then assemble items in the traveling medical kit. Consult a doctor, good doctor, and these items are first aid, reference book, insect repellent, sting relief situation, medicines for diarrhea, medicines for mild laxative for constipation, antacid for indigestions, antifungal or antibacterial cream, lotion, analgesic, that is pain relief, medicines, for example, paracetamol or aspirin, blister and wound patches, for example, sticking plasters, medical adhesive tapes, wound dressings, for example, crepe, bandage, stitch tips, safety pins, a good quality scissor and tweezers. These things are not allowed in the cabin luggage. Low potency hydrocortisone, a cream fluid and electrolyte replacement powder or tablets, for example, electrol. It is also available in Tetra packs, eye lubricants drops, earplugs, sunscreen lotion. Check SPF value with good doctor. Thermometer. Nowadays, electronic thermometers are also available. Antihistamine tablets for bites, stings or allergies, cold or flu tablets, cold and cough tablets, motion sickness medicines, throat lozenges or drops, antiseptic solutions for cleaning wound and or bites, and antiseptic creams to apply to a wound. If tourist is traveling to a high altitude areas, for example, like Leh, Rohtang, etc., developed countries, for example, France, USA, etc., remote places, for example, Kailash Mansarovar Yatra, Amarnath Yatra, etc., tourists must keep medicines in sufficient quantity. Tourists taking medicines regularly must keep in sufficient quantity. Regular prescription medicines in the original pack. Doctor's prescription of medicines you are carrying with you with amount of doses you have to take. Name of the medicines and compositions must be readable. You may carry. It is your hand baggage. Tourists must be advised to keep the following items. Medical equipment you are regularly, such as a sterile syringe and needles, spare pair of glasses or your eye prescriptions, water purifying tablets, a mosquito repellent cream, hand sanitizer or wipes, digital thermometer, a sterile syringe, altitude sickness antibiotics for stomach, throat, ear, nose related problems, glucometer with strips, blood pressure checking machine, smart watch for health monitoring, balm for headache, nasal decongestants, travel health, travel medical kit, checklist assist, primary survey. It includes DRAB, danger response, always and breathing danger. Firstly, check to the danger to victim. If there is danger, you can try to get rid of danger. If victim is out of danger or normal, you can wait for the medical professional response. Find out whether victim is conscious or unconscious. Find out whether the patient is alert or not. You can try to see whether he responds to touch or no. Airway, find out whether the airway is clear or choked. Breathing, see whether the victim is breathing properly or unable to breathe. The first aider must look at the chest or mouth of the victim and try to find out whether the victim is able to take breath or unable. In case of seriousness, he can go for artificial respiration. First aider must have experience and skill set to try artificial respirations. A wrong approach has problem also for the victim. So secondary survey, it is known as DOMS. It means deformities, open wounds, medical alert, tag and swelling. If the victim is taking proper breath, only then go for secondary survey. Recovery position. If victim is breathing and unconscious, there is a risk of airway obstruction. So take him to recovery position to minimize risk factor. For recovery position, first aider should first remove specs, goggles, glasses of the victim, put his legs straight, put his or her arms near to you at right angle, Put other arm across the chest and back of his hand against nearest cheek. Make sure that foot of the victim is flat on the ground surface. Pull down the victim's raised knee, roll him her over towards you. Move his upper leg so that the casualties help and knee are bending at right angles. This makes sure they do not roll back onto his or her face. Tilt the head back to keep the airway. Observe him carefully. Cardiopulmonary resuscitations, that is CPR. The basic purpose of cardiopulmonary resuscitation CPR is to maintain flow of oxygenated blood to heart and brain in the human body. As per the new guidelines, first aider should go for CPR if there is no breathing in place of checking pulse. Many first aider can sense pulse properly. So these are the precautions one has to properly understand, and proper training may be given. Training for the first aid. Training for first aid is given through many social organizations. Major one is Red Cross Society of India, St. John Ambulance, etc. Many non-governmental organizations, NGOs working in the field of medical can also organize training for first aid. Types of first aid. There are many types of first aid. It depends on the purpose and conditions. Marine, aquatic, first aid, battlefields, first aid, hyperbaric, first aid, oxygen first aid, wilderness first aid, mental health, first aid, marine first aid, and some of the marine first aid sources can be seized from marine first aid is related to aquatic field. It is used in case of injury while traveling in water bodies. Battlefield first aid, it is related to the battlefield victims, how to provide them first aid in case of emergency and bring them to the nearest hospital. Hyperbaric first aid, it is related to scuba diving. Activities, oxygen first aid. Oxygen first aid, which is one of the procedure, and our first oxygen first aid is related to the condition of hypoxia. Wilderness first aid, it is used in case of terrain, weather, etc., when it may take few hours or days to reach the nearest hospital or ambulance. Mental health first aid. So mental health first aid that is can be given by the trained guide in case of someone is very serious. It includes how to support anyone suffering due to ill mental health and how to identify beginning of mental problems. It helps in case of crisis. It is tough independently. Artificial respiration. Artificial respirations means restoration or initiation of any individual's breathing using mouth to mouth or manual or mechanical method. It is also called artificial ventilation. It is a metabolic process referring to overall exchange of gases in the human body through pulmonary ventilation or external respiration or internal respiration. Mouth to mouth resuscitation is a part of CPR. First aid and tourism and travel industry is closely related to the first aid. In tourism, a person travels from one place to other. There are chances of accidents, ill health or crisis due to medical problem. In such cases, people escorting or attending the tourist must know how to handle a group member or individual tourist with utmost care and how to give him first aid. Normally, it is believed that few items kept in one box are first aid kit. It is more than our general belief. There must be a formal training for a tour guide about the use of the first aid. Artificial respiration and common diseases, as it is a practical problems. So therefore, he should know the purpose, aims, motive behind the first aid. He should have proper practices Also, there are many casualties during the adventure tours on mountains, and tour guide accompanying tour group must have first aid box. He should have ideas about snow frost, snow bites, hypothermia, etc. A tour guide working on the cruise must know waterborne diseases. The most common program is seasickness. Symbols of the first aid. There is a symbol of first aid you might have seen with International Red Cross and Red Crescent. That is marked with the red color plus marks. Vaccination. It is the administration of antigenic material to stimulate immune system of any individual. Vaccinations helps to stop infectious diseases. Non-immunized tourists must be offered the routine vaccinations recommended in their national immunization schedules of the country in which they live, in addition to those required for international travel. For example, yellow fever vaccine. Smallpox was the most likely disease tried to control through the vaccination. According to the World Health Organization, that is WHO, all travelers must have vaccination of routine diseases to remain protected. Tourists are advised to check that they are fully vaccinated against tetanus, whooping cough, measles, rubella, mumps, diphtheria, and polymethatic before starting their travel. So these are some of the important vaccinations, diseases which can be controlled on time vaccinations. Travelers should be given a personal record of vaccination. Major travel related health risks. There are few major travel related health risks, and these are environment related. Exposure to blood and body fluid, infectious diseases, and potential risk injury and violence. Psychologically health precautions in tour or travel. Anyone going on tour or travel must take few precautions, and these precautions protects from heart related problems. Major precautions are given below. That is consultation with the doctor before traveling. Tourists going to foreign countries must consult a good doctor 4 to 7 weeks in advance, and they must take his advice about health problems. If tourists are traveling to a country affected by malaria, and he must take anti-malarial medication, and you may collect information about traffic accidents, dental, age appropriate, and gynecologist related examinations are also highly advised by the WHO. All tourists for travelers must go for comprehensive health insurance. Tour or travel related risk factors. Major factors determine the risk for the tourist are given below. Tourist transport related travelers should be aware about the risk of accidents under the influence of alcohol or drug during the road journeys, destinations in the itinerary, season of travel, and there are more cases of waterborne disease during rains, purpose of journey, standard of living conditions, for example, type of hotel, motel, dharamsalas, etc. And when these accommodation, food, water, sanitation, qualities are good standard, there are less risk factors for health of the tourist, except he is having some problems before the starting of the journey. It is also true for the business tourist visiting the major cities and staying in good accommodation. Tourist travel warning issued by the government time to time must be taken seriously. Quality of food, quality of water, and sanitation related facilities shared by the tourist behavior of the travelers. Behavior means going outdoor during the travel. It may cause malaria, so tourists must avoid mosquito bite, exposure to rodents, insects, and other animals. Infectious agents, contaminated food items may cause serious problems. Health of the tourist, mode of tourist, transport, duration of visit, and behavior of tourists are also important for exposure to any infectious diseases. So these are some of the precautions travel related or during the journey. Assess health related risk associated with the travel to a particular place, a region, or a country. Medical kit and toilet related items, travel insurance, role of a tour guide or tour escort. Tourist responsibility, medical checkup after the tour. Common diseases in India, and the common diseases in India are given below, like hepatitis A, hepatitis B, typhoid, yellow fever, malaria, dengue, viral fever, Japanese encephalitis, rabies. Further details about diseases and vaccinations may be collected from the source, travel advisory, etc. So these are some of the important advisories before one is starting or commencing the tour for his own health. Some keywords which are used: CPR, cardiopulmonary respiration; 3 B's, that is breath, bone, bleeding; 4 B's, that is breath, bone, bleeding, and burns. WHO, World Health Organization, SPF value. Questions can be: what is first aid? What are various precautions tourists must take before going on a tour? What are various components of a first aid box kit? What is vaccination and what is CPR? Some references are. So with these, I want to end my session here. I hope you enlightened with this session. Thank you very much.